This skill will start with the opening. Knock and identify the patient. Introduce yourself by name and title. Describe what you will be doing and obtain permission. For this skill, the patient will be sitting in a chair by the bedside and may or may not have her shoes and socks on. Close the curtain and wash your hands. After washing your hands, place a barrier on the floor under the patient's feet. Gather your supplies and set on the barrier on the floor. 1 towel, 2 washcloths, basin, soap, and lotion. Be careful not to allow the clean linens to touch your uniform as you gather the supplies. Take the basin to the sink and turn the water on and off with a paper towel. Check the water temperature with the inside of your wrist and fill the basin 1/4 to 1/2 of the way full. Allow the patient to check the water temperature. Place the basin on the floor on a barrier and obtain a set of gloves. Kneel onto the floor near the barrier. Pull the patient's pants leg up and put your gloves on. Remove shoe and sock if the patient has not already done so. Lift the patient's foot up by supporting the lower leg and look for obvious wounds or signs of infection. Then gently place the patient's foot in the basin. Tell the evaluator you would soak the foot for 5 to 10 minutes. Place the washcloths in the basin to wet. Gently lift the foot from the basin and set onto the towel. Wring 1 washcloth out and apply soap directly to the washcloth. Wash all surfaces of the foot, top, bottom, heel, and between toes, observing for any redness, bruising, rashes, sores, or other abnormalities. Support the patient's leg at all times while washing. Place the washcloth to the side after washing. Place the foot back in the basin and use the second washcloth to rinse the foot. Place the rinse washcloth to the side after rinsing. Gently lift the foot out of the basin and set on the towel. Dry all surfaces of the foot with the towel. Ask the patient about pain or discomfort as you perform this skill. When all surfaces are dry, squeeze a small amount of lotion into the palm of your hand and warm the lotion between your hands. Apply the lotion to all surfaces of the foot except between the toes, gently supporting the foot as you lift it. Wipe the lotion off with the towel. Pick up the towel and place it to the side. Put the patient's sock and shoe on her foot. And make sure you tie the shoe securely. Gather the dirty linen and place in the hamper. Take the soiled basin to the sink and clean according to the basin cleaning procedures. The water inside the basin will be disposed of in the sink. You can turn the faucet on with your hands because at the end of this skill, your hands are no longer considered clean. Turn the faucet on and rinse the basin, then turn the faucet off. Dump the rinse water into the sink and set the basin down inside the sink. Do not touch the basin at this point. Spray the inside of the basin with a disinfectant spray, and using a paper towel between your unclean hand and the clean basin, pick up the basin. Dry the inside with a new paper towel and discard. Dry the outside with a clean paper towel and get a paper towel to open the drawer. Pick up the soap and lotion on the way to the drawer and place them in the basin. Use the paper towel to open the drawer and set the basin inside. Throw the paper towels and the barrier that was under the patient's foot in the trash. Remove your gloves. Ensure that the patient has her call light and the patient's environment is neat and clean, and ask if he needs anything else. Open the curtain and wash your hands. Review the steps of your skill and tell the evaluator your skill is done.